Hello, my name is René Picard, and today we're going to discuss canine heartworm disease. Heartworm disease is actually caused by a parasite called the heartworm, which is a worm living in the heart. The original infection is caused by a mosquito bite if the mosquito is carrying what we call microfilaria, which is the larval state of the heartworm. 1 to 3 days after the bite, the larva is going to migrate from the superficial tissues to deeper tissues into the bloodstream. After 50 to 70 days in the bloodstream, they're going to reach adulthood, and they're going to migrate toward the heart and the lungs. About 6 months after the mosquito bite, the heartworm is going to begin to reproduce and to reject microfilaria back into the bloodstream. If a mosquito bites the patient during this period, it's going to ingest some microfilaria as well. After 2 weeks of gestating into the mosquito, this larva is going to be ready to infect another patient. And this is the life cycle of the heartworm. This is what microfilaria looks like on a microscope slide, but I'm going to come back to that later. And this is what a heart looks like after a very severe and untreated heartworm disease. As you can see, the heartworm is growing very long and taking all the space into the blood vessels and to the heart itself, letting close to no space for the blood to flow and the heart to beat. Because mosquitoes live in moist and warm places, it is not surprising to see that the south of the country is much more affected than the north of the country. I personally worked in Virginia, and I used to see there about a case every 2 months, number 1 on the map. I then worked in Alabama, number 2 on the map, which is the worst state of the country with Mississippi. And I used to there see about a case per week or per 2 weeks. And for the past 4 months, I've been working in Seattle, Washington, number 3 on the map. And so far, in 4 months, I've only seen once. However, this numbers might change in the future. For example, many dogs are being rescued from the southern states and taken north. And despite being tested, the test can give false negative, which I'm going to explain later. But that's so for example, global warming. Global warming is making more states warmer all year round and making it easy for mosquitoes to live and develop in. The very first symptoms of heartworm disease is going to be a consistent, non-productive cough, reduced energy and lethargy, heavier breathing. For example, when your pet is breathing and his whole abdomen goes up and down, if your pet is getting out of breath for very mild exercise, and loss of appetite too. If nothing is done, we're going to go from acute discomfort to chronic and possibly life-threatening issues because the worms are going to develop, get longer, and multiply. And as you can see in this picture, they're going to occupy most of the space into the major blood vessels. Congestive heart failure is when the heart is getting so stressed by the effort it is producing, it is getting larger and larger and larger to be able to push the blood as it is supposed to. As you can see in these pictures, on the top one, the heart is a normal size, and on the bottom one, the heart is very enlarged and very round, which is also going to trigger the buildup of fluids in the chest and in the abdomen. This is why one of the symptoms is also a distended abdomen too. We have different ways of diagnosing heartworm disease. The very first one, probably the most common and convenient one, is what we call a 4DX SNAP test. As you can see in these pictures, it tests not only for heartworm disease, but also for tick-borne disease as well. It is a very easy test to run. You just need 3 drops of blood, and we can run it in-house, and it takes less than 10 minutes. However, this test is reacting to an antigen produced by the female adult heartworm, meaning that if you test a dog within the first 6 months of being infected, the dog is going to test negative despite carrying microfilaria in his bloodstream. This is why, for example, some dogs are taken from the streets, they are tested negative, and a few months later they are tested again, and this time testing positive. Another way to do it is to do a blood smear to look at microfilarias. However, if the blood is drawn during a time when the worms are not producing much and the quantity of microfilaria is low, the chance of getting it can be low as well. So it is not a perfectly reliable test too. You can also get false negative with this test. Treating heartworm disease is a long process. It can be difficult depending on how stable the patient is, and also risky depending on how advanced the disease is. What we want to do to begin with is to assess the patients and make sure they are healthy enough to go through the treatments. For example, if the dog has been infected for a long time and is showing a sign of congestive heart failure, we want to get that under control before we begin to treat the actual heartworm infection. So the trick with this disease is that if you kill the heartworm, they're going to release a bunch of dead body into the heart, lungs, and the major bloodstream, which means they can possibly obstruct the blood flow and be deadly. So the very first step, once the patient is stable enough, is to give a heartworm preventive, which is going to kill all the microfaria in the bloodstream. So it's going to stop the cycle and stop them from reproducing. Then we're going to give the patient doxycycline and prednisolone for about a month by mouth every single day. Doxycycline is an antibiotic that we're going to use to prevent any infection that might be triggered by the decomposition of the heartworm in the body, and prednisone to avoid any inflammation of the tissues. We're going to keep the dog on preventives for 60 days, so 2 months, and at day 60, we're going to give the first dose of melarsomin, which is a drug that we give IM, so in the muscle, generally either in the thigh or in the back muscles. The goal of this drug is to slowly kill the adult heartworms. We don't want to kill them too fast, of course, otherwise it might, as I said before, obstruct the blood flow. On day 60, we're going to do the first injection, and then we're going to keep the dog on heartworm preventive. And on day 90 and 91, we're going to do two more injections 24 hours away. On day 120, we're going to test the dog to see if he's still testing negative or positive. And when I say testing, I say blood smear testing to make sure there's no microfaria in the bloodstream. During treatment, the patient has to be calm and avoid intense exercise, because the more the heart beats, the more chances we have for heartworm to be unstuck and to be free in the bloodstream. The best and easiest way to prevent such infection is to use the preventives. Here on this picture you can see the three main ones, being Heartguard, Interceptor Plus, and Simplicatrio. The way they work is they kill the microfaria as soon as they enter the body, giving them no chance to grow up and to infect the body. They are prescription medication, and your dog needs to be seen at least once a year to be by DVM to be prescribed some medication. You can find cheaper options over the counter. However, these drugs are not always as controlled as the other ones are, and we see more adverse reactions and also sometimes less effective as well. Thank you for listening. This is the list of my references. Have a good day.